Right, open enrollment for Medicare begins this Sunday. Here to tell us more on what we can expect when enrolling this year is Craig Gusson from Auerbach and Gusson Insurance. Did I pronounce it right, Craig?
You got it.
All right. Okay, so President Trump signs this executive order today.
Yes, he did.
How's that change things?
Honestly, not a lot. When I heard that, I started laughing because in California, any company can come to California and offer health insurance. You just have to provide the mandates that California requires every health insurance plan to do. If they do it, they do it. Oscar came from New York to cover California and provided on-offer health insurance a couple years ago, and it's exactly what they did. So that's not a big deal. The other one, the short-term health insurance is a bigger deal because now if somehow you lose insurance during the year, you can now buy a short-term health insurance plan that at least give you some health insurance for up to 12 months. You're still going to pay the penalties and any kind of fine because you don't have health insurance approved by the ACA, or also known as Obamacare. But besides that, it sounds great. That's about it.
That's about it.
Yeah.
Just sounds good. Okay, what do we need to know about the open enrollment period?
Medicare.
Medicare.
As of Sunday, Medicare open enrollment. So anybody on Medicare can go and look at the plan and make changes. Make sure your doctor and hospital that you want to use is still on the plan that you have. Make sure if you have any new prescriptions that those prescriptions are now on the plan you have. If not, great time to look at some different options and change. Big thing is there's 1,000 people a day in California who are turning 65. So it's really important that if you're going to turn age 65, that you start looking at what you need to do. You need to go to Social Security and get your Medicare card, Part A and Part B. Mm-hmm. Then you go and you start looking at plans. And there's a lot of different plans you can choose from. There's a Medicare Advantage plan, which is a lot like an HMO, like a Kaiser. Mm-hmm. There's also a Medicare Supplement, which is more like a PPO. And there's a bunch of different plans from A to, I think it's G. Plan F is a plan that we sell a lot because you can go to anybody you want. As long as the doctor takes Medicare, you can go see him. It runs about $135 a month. You add prescription to it, you're looking at about $150, $160 a month. And again,
that covers everything.
Everything.
Right? Everything.
And the only other thing you're going to pay for is Part B of Medicare, because Part A is free. Medicare is about $135. So you're looking under $300 a month. You have incredible coverage.
And you got to consider, if you're turning 65, previous to this, you've been paying a lot more than that.
Probably $700 to $1,000 a month.
So this is a great deal.
And you had co-pays and deductibles, and this you really don't have any of that. So great thing to do. Even though you might go, hey, I can get health insurance for my job, look at the difference in cost and the benefits of night and day. So that's something we're talking to everybody about. It's confusing as heck. So what you want to do, you want to reach out to a Medicare agent like myself and others out there, because all of us, we belong to the California Association of Health Underwriters and the San Diego Association of Health Underwriters. We have meetings all year long talking about Medicare and all the different things you need to know.
Sure.
And because of that, we have the education, we can help you. And instead of you trying to spend hours and hours trying to figure it out, I have people every day saying to me, I don't get this, and I am a pretty smart guy. And in 5 minutes, we just talk about who do you want to go see, what doctor. If you're Kaiser, very easy, we're going to put you in this plan.
And you got a website our viewers can go to?
Yes.
What is it?
It's just Auerbach and Gusson.com, I think. I don't ever use it that much. But and if you want to look at, if your doctor or hospital is a network, just go to Medicare.gov.
Okay, and really quickly, let's talk about the kids in the
kids.
Short time we have left.
So Health and Human Services changed the way kids are rated. So right now, kids' rates are going up anywhere between 20 and 34%. Because what happens is that in the old days, if you were 21 and I was 64, the difference would be 5 to 1. So whatever you paid, I'm going to pay 5 times as much. Now it's 3 to 1. So whatever you pay, I'm going to pay 3 times as high. That's the maximum. But with kids, they just up the percentages of what they call the base, which is a 21-year-old. So because of that, if you have kids on a plan effective January 1st, then you're going to pay anywhere from 20 to 34% higher in cost.
That's a lot. Because
of the new ratings. And it's not something where I can just give you a blanket. It's all based on age of your 15, 16, 17, 18. So be aware of that. Cover California open enrollment is November 1st to the end of January. There's going to be some changes in that, nothing really major. Co-pays going up and down depending on the plan, maximum out of pocket going up and down depending on the plan. Just do your research, work with an agent who can help you. It costs nothing to use us.
You're a good guy to know.
Yeah. Well,
when it
thank
comes
you.
to this stuff. I mean, seriously.
You know, we've been doing it a long time. And again, like the doctors and hospitals, the insurance companies pay us.
Yeah.
And it doesn't make a difference which company we put you with. So use somebody that can walk you through it and educate you and help you so that you pick the best plan. Because once you pick it, you're stuck with it for a year.
Okay. Auerbach and Gussin.
Yes.
And that's Gussin.
Yes.
Okay, want to make sure our viewers have access to
Great.
the resources. Thanks, Craig.
Thanks,
Always
Jason.
great. I learn so much every time you're here.
Good to see you.
You too.